Good morning, Jones PT family. We're coming to you today to talk about actually post-surgical care. I think this is a very common thing that people realize physical therapists do, whether it's orthopedic, shoulder surgery, back surgery, that sort of thing. But what's a little bit less known is when it comes to other surgeries, such as vein surgery or especially breast augmentation, breast surgeries. So Natalie actually has a lot more experience and a lot of expertise in more of the lymphatic system and how that all comes into play. So I'm going to let Natalie take over talking about why after a breast surgery it actually is really, really important and vital to your healing to see her or one of the therapists that can help you with that.
So just a couple of quick things that we as therapists have the gift of helping with. One of the reasons that we do what we do is to help bodies move. And bodies need to move everywhere in every system. And so when we have a major surgery, especially a surgery that affects the lymphatic system, often with oncology care, we will take some lymph nodes. We disrupt a system that assists in healing. And so using techniques to help facilitate that system to be more efficient, especially during the post-surgical time in recovery, we encourage healing and we assist every individual in their healing journey quickly.
So the wonderful thing too with Natalie's experience and expertise, she was at a clinic that did primarily oncology care and lymphatic care. And just even her knowledge as far as it goes with ports, what procedure was done, because there's multiple procedures, especially if it's oncology related. But also we don't want women to underestimate the effect on the body physically and emotionally, whether it is because of an oncology cancer journey, or maybe it's an elective surgery of either a breast reduction, breast enhancement, augmentation, a lift, that sort of thing. These are all areas, even if it's a lumpectomy for diagnostic reasons, these are all procedures done to the body, whether it is done elective or medically necessary. They are affecting your body. It's affecting you physically, and all of those decisions and surgeries also have an emotional impact or are made from an emotional standpoint also. So as most of you know at Jones PT, we do treat addressing all aspects of the body in that way that there may be maybe a fear, there might be a guarding, there might be a grief involved with the procedure that you may not even always realize. And it's wonderful to be able to incorporate that with your body's tension patterns and ability to heal because of the lymphatic system. She teaches me every day about the lymphatic system and where it all drains.
Yes. And one of my favorite things to consider is, especially when it comes to any sort of breast surgery, the surgical experience is happening over top of some of our most important organs, our heart and our lungs. And we talk about blood flow and breathing. We really don't survive without those. So it's such a beautiful place to incorporate what is true physical healing. And that comes from so many different aspects of our body, but in a part of our body that's so closely tied to systems that keep us alive. It's a little different than having an ankle surgery. And so we just like to incorporate looking at the whole body, but also saying this came from a place of either not having a choice or making a choice after years of determining, should I do this or not? So we just want to be here to help you through that journey of healing and continue to help your body move in the way that it was designed to move and to give you back the life you want to live.
Yes. So, and with that being said, whether you are coming up to a surgery, you're trying to discern a surgery, or maybe you had a surgery 15 to 20 years ago, it's never too late or too early to address this and to help the body move together as one and to be more balanced and work with itself more fully. I didn't say that very well. So yes, please do not hesitate to give us a call. Honestly, Dr. Natalie Weir is definitely our specialist when it comes to lymphatic. So I would highly recommend that when you do call for something breast related, that you see her first, and then she can determine from there if there's another therapist that would fit your needs, your schedule, that sort of thing. So don't hesitate to reach out, and we look forward to hearing from you.
Absolutely.